Hi there.
Hello.
Can I ask, what does your mouth mean to you?
That's a very interesting question. I guess what it means to me is that my mouth is how I connect with the world around me.
It's how I make friends. Having a healthy smile really gives me confidence.
My whole life I've looked after my mouth, and it's always looked after me.
It keeps me feeling young and healthy, like I can do anything.
I use my mouth all the time to show how I'm feeling.
La 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 la.
I really like to sing, so my mouth is my instrument, you could say.
I love food. My mouth and I have traveled the world together.
I use my mouth to call my best friend. Leo, up here.
I've told many stories with my mouth.
I wish he'd keep his mouth shut sometimes.
Mozart for blowing bubbles.
As a strong woman, I use my mouth to stand up for what I believe in.
I can say the alphabet backwards with mine.
Honestly, I think my mouth can be a bit noisy on a football pitch.
Z-Y-X.
I'd love to stay and talk, but I've got a dentist appointment.
Afternoon and welcome to our first World Oral Health Day public webinar. I am Dr. Khanyi Makwakwa. I am the SARA National License Officer, and my major role is to be a link between the World Dental Federation and the South African Dental Association. Professionally, I'm a specialist in community dentistry working at Makwakwa Health Science University in the School of Oral Health Sciences. As you've just seen from the video, today we celebrate World Oral Health Day. So the question for today is, what does your mouth mean to you? But before we go into the question, we should be asking, what is this World Oral Health Day? So World Oral Health Day is a global campaign celebrated every year on the 20th of March. And what do we ask? We ask the world to unite to help reduce the burden of oral diseases, which affect individuals, health systems, and economies everywhere. What do we aim to do? We aim to empower people with the knowledge, tools, and confidence to secure good oral health. So why is it important to celebrate World Oral Health Day? Now, when it comes to oral diseases are a major health concern for many countries and negatively impact people throughout, especially even in South Africa. South Africa is facing an oral health crisis with millions of people suffering from tooth decay, severe gum disease, tooth loss, and oral cancer. Oral diseases, or the consequences of oral diseases, lead to pain and discomfort, social isolation, and loss of self-confidence, and they're often linked to other serious health issues. And yet, there is no reason to suffer because most oral health conditions are largely preventable and can be treated in the very early stages. Now, more about World Oral Health Day. World Oral Health Day was launched in 2013. Currently, we have over 200 countries that participate in World Oral Health Day. And we've had a theme for the past 3 years, and the theme was Be Proud of Your Mouth. The aim of the campaign is that we want people to value and take care of their oral health and make the right decision to protect it. The focus for 2021 was on how oral health affects our overall health. There is a link between good oral health and general systemic health. In 2022, the highlight was how a healthy mouth is important for our happiness and well-being. We were looking at the mental and the psychological impact of oral health, which then leads to good quality oral health. In 2023, which is this year, we are now focusing on the importance of caring for your mouth at every stage of your life. It is important that we take care of our oral health because it is fundamental for breathing, eating, speaking, and contributes to a person's overall physical and mental health and their well-being. And as you saw from the clip, depending on what value you place your mouth, it could be singing, it could be communicating, it could be calling your friend. So you need to place a value on your mouth, and that will motivate you to take care of it. So what we did as well, we then looked at frequently asked questions. Now that I have explained what Oral Health Day is, the importance, there are some frequently asked questions that we get as an association. And in a very short time, I will attempt to answer some of the questions. So one of our frequently asked questions are, what are the different ways to improve my daily oral health routine? This is all about cleanliness, cleanliness, cleanliness. Meaning that if you want to improve your oral hygiene, you need to at least brush twice daily. You need to floss, yes, floss in between the teeth, because that is where your plaque is also going to accumulate. And by simply just brushing, you're not going to be able to remove it. Maintaining or improving daily oral health also speaks to a balanced diet, meaning that you have to have a diet that is low in refined carbohydrates, low in sugar, and low in the acid drinks that you're going to take. And those will assist in making sure that your teeth do not demineralize. But I mean, we know that especially kids, even the older generation, will love the sweets. So if you do consume the sweets, you must always make sure that to a certain extent, you maintain your pH. After you consume the sweets, you can rinse out your mouth and just spit out so that at least you remove the debris. Now, the other question that we always get is, I'm suffering from bleeding gums while brushing my teeth. How can I solve it? Now, to address this question, I will first address the causes of your bleeding gums. It can be two. It's either you have an infection in your mouth or there is trauma that you have experienced. Now, infection in your mouth can just be in the gums, which means that we will then just call it gingivitis, because you would have red, swollen gums. But then the disease, if it is not treated, can progress to what we call periodontal disease. Now, when you have periodontal disease, it means the gum disease now extends just beyond the gums and now affects the supporting structures of your tooth. That is where you will continue to have the bleeding gums, and at times you can start having your teeth being mobile, which is being loose, and then you are at a threat or a risk of losing your particular tooth. So what you need to do, you need to make sure that you maintain your cleanliness, but should you find that you have bleeding gums, please visit your dentist. Now that brings us to another important question. How often should you visit the dentist? Now it is recommended that you should visit your dentist every 6 months, or if you have a particular challenge, you can even visit your dentist sooner. Now, there's a question we also received. I brush my teeth twice a day. What difference will be using floss do? I've already attempted to answer in the first question, but floss is very, very, very important. It is important because if you do not clean in your interdental spaces, the spaces that are between your teeth, you're more likely to get an accumulation of plaque, and that will lead to gingivitis, which I've already explained, would then be your swollen red gums, which will bleed. And if they're not treated, you will eventually get periodontal disease, which will lead to loss of teeth. And then the next question that we had was, how do I choose a toothbrush? This is a very, very important question because most people believe that the harder the bristle, the better work is going to be doing. But no, remember we spoke about trauma of the gums. If you're using a bristle that is extremely hard, then it's going to damage your gums and it's going to lead to infection. So it is recommended that you use a soft nylon bristle, and those are the best options. Now, also what is important is the shape of your toothbrush. It should not be a square. The edge of the toothbrush should actually taper so that you can be able to brush right at the back of your last teeth in your molar areas. Now, the question that we have, I think this one is the last one, and the last two questions are actually very related because one speaks to xerostomia, which is a dry mouth, and the other one speaks to halitosis. Now, xerostomia is caused by different things, but in essence, it is just a patient who's suffering from a dry mouth They could have other systemic condition that causes the xerostomia, but other causes, meaning the fact that a person is not drinking adequate water, so you must be drinking your 2 liters of water, anxiety, nervousness, stress. There are certain medications that if you're on, if you look at the side of the packet, it will tell you that the side effects are actually xerostomia. Aging as a process also causes xerostomia, cancer therapy, smoking and the use of tobacco products, the use of certain drugs, injury, surgery, and exercising or playing in the heat. So this one leads to your dehydration. So you just need to make sure that when you experience your xerostomia, it's important to establish what the cause or causes are, so that the treatment is related to what is actually causing your xerostomia. So it's important to go visit your dentist. Now, this is the one that we get the most frequently asked question is what causes halitosis and how can I actually solve the halitosis? So halitosis has many causes. The simple term for halitosis is just bad breath. You may have causes inside or outside the oral cavity, which is your mouth. And then in the mouth, what you look for is your poor oral hygiene. We've spoken about your gum disease, your dry mouth, your infection, whether you smoke or not. And what's also important is that certain foodstuff are going to cause a certain level of halitosis. For instance, if you eat garlic every day, we always blame the garlic, you will have some form of halitosis. So as similarly to xerostomia, the treatment for halitosis is largely dependent on what caused it. If the origin is of dental or oral health origin, then you would have to visit your dentist so that they can give you the appropriate treatment. And if it should be established that the cause is actually external to your mouth, then the dentist will refer you appropriately. Now, those are the questions we had for now. I've then dealt with all the questions. I'll just check in the Q&A if we have any more questions. We don't have questions at the moment. I think we've managed most of the questions. What I will share with you now are actually the activities we'll be having for World Oral Health Day. As I said, it's a campaign. It starts on the 20th of March, but it is the beginning. We celebrate World Oral Health Day every single day. So for the week, what we will be having webinars. This is our first webinar, a public oral health webinar. We will have a professional webinar on the 23rd of March at 7 o'clock, of which the details will be shared. As an association, we will be visiting schools, children's homes, hospitals, and health days, all in view of the fact that we want to promote good oral health. We'll be having the radio interviews, and we'll be assisted by the Young Dentist Council of South Africa, dental university students, as well as the Pedodontic Association of South Africa to host the campaign. As an association, we have 2 sponsors who are going to be assisting us. The first one is Helion. They're going to assist us in handing out toothbrushes at Children's Home in South Africa. We're going to visit the dialysis unit in Benoni, and we will also be visiting children's cancer wards all over South Africa. With regard to Colgate, we'll be handing out approximately 20,000 oral health kits to children between the ages of 4 to 8 years all over South Africa. We will also be broadcasting on Clicks radio station. We'll have 5 young dentists going live on the radio. We will share that information as well. And lastly, we'll be having a SARA webinar for oral health professionals on the 23rd of March, of which the professionals can register for the webinar. It's going to be free of charge. So I have checked again. There are no questions in the chat. I'm wishing all of you a very happy World Oral Health Day. I thank you for joining us. And I think where we started, we should be asking ourselves, what does your mouth mean to you? How do you value your mouth? How do you take care of your mouth? But in all, having said all of that, just know that assistance is out there. Should you be having a challenge, or routinely, it should be routine that you visit your dentist at least twice a year, every 6 months. Thank you. That brings us to the end of our public webinar. Thank you.
Can I ask, what does your mouth mean to you?
I've told many, many stories with my mouth.
As a strong woman, I use my mouth to stand up for what I believe in.
La 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 la.
I really like to sing, so my mouth is my instrument, you could say.
I can say the alphabet backwards with mine. Z, Y.